Hello and welcome, I'm Dr. Nathan, and as part of our educational series this week we're going to be talking about meniscus tears. Okay, let's begin with the anatomy. The meniscus sits into the knees, and up top we have the big bone called the femur. Down below we have two bones, but it's mainly the tibia that makes up that knee joint. Okay, and in between we have our meniscus. Those meniscus, they're responsible for shock absorption. So whenever you run, jump, climb, walk, that kind of thing, they're taking that pressure. Now, why do they tear? Normally it's because an athlete has fallen incorrectly, or they've fallen awkwardly, or they've twisted their knee, and that will create that tearing sensation. Okay, they might not recognize that straight away. It might take some time for the pain and the swelling. You might just think, that it's maybe a small grade muscle tear or a muscle sprain. But it is very important that if you do suspect that it's a meniscus tear, to stop the sport, don't jump back on, because you risk further damage. Now, in terms of treatment options, this is where you probably be looking at a surgical opinion. And depending on that surgical opinion, you either have surgery or you don't. Now, let's assume that you weren't to have surgery. We'd be looking at basically mobilizations, soft tissue to those muscles around that are tight, okay? And exercises to get you back to functioning at that knee as best as we can. More than likely, however, you'll probably be looking at surgical opinion, and this is where your rehab is important. So if you were to come see us, we'd be looking at prehab, and that's where it's rehabilitation exercises before the surgery, and the idea is get you as good as possible so that when you have the surgery, you respond quicker and you heal a lot quicker as well. Okay. Now, in terms of after the surgery, there's also post-rehab exercises to do, and the idea behind that is to get you from surgery to back into your sport as quickly as possible. Okay? Now, if you'd like to know more about meniscus tears, or if you had any other questions, feel free to give us a call. You'll find our number in the link below. Thank you.